30 years ago, the American College of Chest Physicians recommended that people start taking a daily aspirin. Studies had shown that the risk of a second heart attack was reduced by taking a daily aspirin. So it was presumed that taking an aspirin every day might prevent the first heart attack as well. By 2007, 50% of all U.S. adults over age 65 were taking a daily aspirin. Aspirin is one of our oldest medications, dating back to the time of Hippocrates and Galen, so over 2,000 years. They found that willow bark was useful in reducing inflammation and in helping with pain and fever. By the 18th century, ground, dried English willow bark was used for treating malaria. The current form of acetylated salicylic acid was invented by a fellow named Felix Hoffmann, who was working for the Bayer Company in Germany in 1897. A single baby aspirin will inactivate all of the body's platelets. Platelets have a lifespan of about 10 days, so if you take an aspirin, all of your platelets will be inactivated, and within 24 hours, you'll have about a 10% new platelet function. Platelets are what causes the clotting. The platelets, these small fragments, will gather wherever there's a hole in the artery and clot it off. The concept was that since heart attacks are caused by clotting in the heart's arteries, by reducing that clotting, you would prevent heart attacks. In addition, daily aspirin has been found to be useful in reducing the risks of colon and stomach cancers by about 1/6. So, is taking a daily aspirin a wonder drug? Should everybody be doing it? No. If you are at high risk, if a person's at high risk for a heart attack or stroke, then yes, a daily aspirin might be useful. But otherwise, there's a lot of danger, a lot of complications from taking daily aspirins, and it is not recommended. Aspirin has 4 major effects. It has analgesic effect, reducing pain, antipyretics, reducing fever, anti-inflammation effects, and as we mentioned, preventing blood clots. All of these effects come from its ability to inhibit the production of prostaglandins. While for these effects, aspirin is useful, we need some of these prostaglandins. They do things like protect the stomach lining with mucosa, they protect the kidneys, and of course, you need to have your clotting factors so you don't bleed when you cut yourself. So even though the initial assumption was that taking an aspirin a day would prevent heart attacks, large-scale studies published in 2018 showed that for people over age 65, low-dose aspirin did not prevent primary or secondary heart attacks or strokes. Besides being ineffective at preventing cardiovascular disease, low-dose aspirin caused major problems: stomach disease such as ulcers, kidney disease, asthma, and major bleeding effects, with an increased mortality in those who took the aspirin daily versus those who did not. In addition, there's a long list of medications that interact with aspirin. Some of the more obvious ones, such as the nonsteroidals, such as ibuprofen, but also some that you might not expect, such as the nasal spray for live influenza virus vaccine. Current guidelines from the United States Preventative Services Task Force recommend starting daily aspirin on younger patients, like those in the 40 to 50 age range, for those who have a higher than 10% chance likelihood of having a heart attack or stroke. Specifically, people who have a family history of other members of the family having heart attacks at a young age, patients who smoke or have high blood pressure or other high risk factors. Those people should be taking a daily aspirin. However, otherwise, they do not recommend daily aspirin, and also mention that there are a lot more effective ways to prevent heart attacks, such as stop smoking, take statins, which will lower your cholesterol, and keep your blood pressure under control. Further, there's very little benefit for people in the elderly range, certainly over 75, for taking daily aspirin. Now, aspirin does have its uses, particularly on a temporary basis. If you have a fever, it's useful for reducing fever. It's also useful for pains, headaches, menstrual cramps, arthritis. There are a number of things that aspirin can be used on a temporary basis that will not cause long-term harm. However, for most people, daily aspirin is only indicated for middle-aged people at high risk for heart disease or strokes or who have certain high risks for certain cancers like colon cancer. This has been Dr. Philip Levin with a quick medical update. Please subscribe to my station and check out my website. Maybe you'll find a book you like.